So for my presentation, I chose to talk about dialectical behavioral therapy. So dialectical behavioral therapy, otherwise known as DBT, what is that? Um, DBT was developed by Marsha Linehan in the 1980s. It was primarily developed for individuals with borderline personality disorder, but since then it has been applied to various mental health conditions. An individual with borderline personality disorder has difficulty regulating strong feelings and controlling behavior, especially in the context of relationships. The research that Linehan completed showed that individuals treated with dialectical behavior therapy were less likely to drop out of counseling, had fewer hospitalizations, and better counseling outcomes. Dialectical behavioral therapy is based on a dialectical philosophy, a biopsychosocial view of problems, and the integration of behavioral therapy with the Eastern beliefs and attitudes of mindfulness, acceptance, and compassion. So, dialectics. The philosophy of dialectics is a way of looking at reality. Dialectics is defined as the art of investigating the truth of principles, opinions, and guidelines. And DBT involves arriving at the truth by examining the argument and resolving the two into rational synthesis by using dialectics. It helps the client to develop a broader perspective of the problems, learn to look for the dialectic pole, consider more options and possibilities, and get unstuck and develop a sense of efficacy and competence. So let's look at emotional regulation. Borderline personality disorder is considered to have both biological and environmental causes. Emotional dysregulation may be the result of attachment wounds, traumatic experiences, loss, the competition between the wants and the needs, or it could be genetic or other causes. DBT assumes that strong, painful emotions and difficulty regulating these emotions cause psychopathology and problems in living. According to DBT, emotions precede the development of thoughts. Once the neural networks associated with emotions begin to fire, they light up other neural networks and incite even stronger emotions. Once a pattern has been established, similar events may set off triggers that result in repeated incidents and of intense emotions. Feelings of abandonment or a need to take action to stop the unpleasant emotions. Linehan believes borderline personality disorder results from the combination of emotional vulnerability and invalidating environment. As such, emotion regulation is essential to DBT. Emotion regulation is the ability to respond to those emotions in a healthy way. While I was going through things, I found this great video of Marsha Linehan herself talking about some of the core concepts of DBT.
I started working with highly suicidal people. As it turned out, the people met criteria for borderline personality disorder, but A, I had never heard of borderline personality disorder, and B, I didn't know what it was. Even if you told me the name, I wouldn't have known. So that was the beginning of the whole thing. I had no idea what I was doing, except that I was studying suicide. What happened was standard behavior therapy of the 1970s and early 1980 blew up. And the main reason it did is because what it requires for it to work is for a person to come in and you be able to say, okay, here's the problem and here's what we'll do to change it. And for the person to say, okay, I'll try that. But the people I was dealing with immediately said, you're saying I'm the problem. And so they were so sensitive to any invalidation or statement that they were the problem that the treatment blew up. And they would either get angry at me, hide behind a chair, storm out, quit therapy, yell and scream, cry, or say they're going to kill themselves. So it didn't take me too long to figure out this was not going to work out. So I thought, okay, we're going to switch to a more acceptance-based treatment. So I'm going to validate and be very accepting. So I tried that. That blew up also, because then the patient said, you mean you're not going to help me? You're just going to listen to me? Most of the patients I treat have already been through a whole lot of therapy where you talk, get listened to, and understood. The problem is talking, being listened to, and being understood doesn't necessarily make anything change. So then they got really upset with me because I wasn't helping them change. So that's when I realized that I had to pull together a major emphasis on change with a technology of acceptance. So I had a technology of change, now I need a technology of acceptance. The technology of acceptance primarily was validation. So it's behavior therapy with a huge amount of validation. So problem solving, validation are the core components of the treatment.
Great video. Absolutely great video. So let's look at some goals of therapy. So the goals of DBT is to develop the dialectical thinking and practice skills that result in emotional regulation, reduce suffering, and improve relationships. And DBT helps clients to recognize how their attempts to deny, avoid, or escape strong emotions paradoxically make those emotions more intense. By helping clients to accept their feelings, providing tools for emotions recognition and regulation, and decreasing emotional avoidance, DBT empowers the client to increase their tolerance to distress, and using coping skills such as meditation and mindfulness to regulate their emotions. The DBT therapist focuses on some goals here. The goals are teaching the client new skills, which is a core component of therapy to help clients develop the new strengths and skills so they can successfully interact in the world. Understand and increasing the client's motivation. The therapists in DBT are trained to understand and recognize clients' capacity for change and motivation to change. DBT attempts to keep clients' motivation high through the use of therapeutic techniques and involvement of family and peers, helping the clients accept what they cannot change. Despite all the therapeutic and techniques available in DBT, there are always things that will upset clients. You know, there's things that they cannot change. Real world application and functionality. Therapists ensure that the new skills learned in therapy can be applied in the real world by the client and ultimately decrease, one of their biggest things is ultimately decrease all self-harming behavior. That's like a huge one, right? We want to make sure that our clients are being safe. So what is the role of the client and the therapist? So the DBT emphasized huge collaboration here between the client and the therapist. While the therapist takes on a directive yet validating approach, clients are encouraged to actively participate in therapy and develop skills that promote emotional regulation and interpersonal effectiveness. The role of therapists is an important factor in the success of DBT. There should be constant attention to that therapeutic relationship. A collaborative therapeutic relationship, of course, is essential. If the client does not trust the therapist and is not engaged in the work, DBT is just not gonna work, right? They need to trust the therapist and be actively participating in the dialectical process. The therapist should be providing psychoeducation skills and training and coaching. It also requires clients to complete homework assignments, participate in role play, practice new ways of interacting with others in individual sessions as well as in groups. So we've kind of gone over a little bit of the dysfunction, the cause of the dysfunction, but that was more looking at borderline. But DBT adopts a holistic approach to understanding clients' dysfunction in general, like understanding the dysfunction, considering the interplay of biological, environmental, social, cultural, interpersonal, cognitive, and emotional factors. By addressing these multicultural aspects, DBT aims to provide comprehensive and effective treatment to help clients achieve greater stability, well-being, and a good quality of life. Nature of therapy. DBT is characterized by a structured yet flexible approach incorporating individual therapy sessions, skills training groups, phone coaching, and consultation team meetings. This comprehensive model allows for a personal treatment plan tailored to the individual's needs. So on assessment area, assessment in DBT involves conducting a thorough diagnostic assessment, utilizing self-report measures, and ongoing evaluation of treatment progress. This helps the therapist understand the client's unique challenges and track their response to interventions over time. The techniques. The DBT employs a variety of techniques, including mindfulness exercises, emotional regulation strategies, interpersonal building exercises. Mindfulness is not only a fundamental component of the client's emotional regulation skills training, but in fact, mindfulness components are also integrated into DBT treatment modules, which is intended to promote distress tolerance and interpersonal effectiveness. However, due to DBT's dialectical underpinnings, mindfulness practices are implemented into counseling and conceptualized through a slightly different lens than other modalities. The concept wise mind essentially represents the DBT treatment approach, as it is a fusion of dialectically opposing rational and emotional forces. Therapists can use this to explore the ways in which the clients have responded to situations using aspects of their rational and their emotional wise mind. With emotional regulation skills, with mindfulness practices at that core of DBT's underlying philosophy, facilitating clients' development of emotional regulation skills is, of course, the first and most critical task of the therapist. Emotional regulation skills aim to promote clients' ability to effectively understand and identify distressing emotions. This is especially important when working with clients who have BPD or borderline personality disorder, or individuals who have any self-harming thoughts or self-harming behaviors, as emotional regulation skills can help prevent life-threatening behaviors such as suicidal ideation and, of course, cutting, self-harming, self-injury. Interpersonal effectiveness. That aims to provide clients with the skills necessary to help them appropriately make requests to convey their wants or to others, manage and resolve conflicts, establish and maintain positive relationships with others, and maintain and enhance self-respect when interacting with others. There's also distress tolerance. So with distress tolerance, it's divided up into two different categories. The first is self-soothing skills, which is intended to combat intense emotions, physiological sensations, and assist clients with letting go of distress. DBT integrates sometimes some CBT techniques like distraction, and that's when the client is unable to practice some radical acceptance. The second category, of course, is distraction skills, which are quick and easy to use and useful in preventing crisis situations or in high-risk behaviors. So here is, you'll see, is an example. It's an example of a distress tolerance skill that a therapist could use with a client. This is one that they can teach the client. So obviously it's an acronym that says improve. And what the therapist would do is ask the client, what would you currently like to improve in your life? And then the client they would talk to the client, okay, imagine your happy place or relaxing nature scene, such as a beach, mountain, meadow, or field. Identify all the meaningful things in your life, things that might bring, or how you might cause you to grow in a meaningful way or bring you joy. Prayer, engage in prayer, meditation, contemplation, introspection, or other spiritual practice to help ease any emotional pain. Relaxation, engage in activities that are relaxing, such as taking a bath, stretching, lying down, deep breathing. One thing at a time, focus on your attention on the present moment. Simply observe, and any non-judgmental, using radical acceptance or loving kindness. Vacation, take a break from stress of daily life or disconnect from social media, email, texting, electronics for the day. And then encouragement could be use of positive affirmations or scripts to encourage you and foster self-compassion. So, if the client was in a moment of distress, this is something that they could go through to try to calm them down. So maybe they're really upset and they could take a few minutes, and maybe their place is the beach, and they would envision the beach and maybe do a prayer or a relaxation exercise, and that would instantly kind of calm them down. And DBT has quite a few of these. This is just one, by the way. So the process of therapy, DBT typically process through several stages, and some of these include orientation, stabilization, change, and maintenance. The therapy process may involve individual therapy sessions, skills training groups, and ongoing phone coaching to support the client's progress. In stage one, in general, this stage is the clients are at the worst level of functioning. The main goal in this stage is to protect the client and keep the client safe, alive, and in treatment. The DBT therapist also helps the client to cope better with co-occurring problems and learn skills needed to start developing meaningful, worthwhile life. In stage two, the therapist helps the client to react less intensely or emotionally to painful experiences or traumatic memories from the past, and thus be more connected to their environment. This often involves the use of some behavioral interventions. In stage three, the therapist helps the client to strengthen what has been learned, to grow in self-efficacy and self-respect, competence, and an overall quality of life and ties to the environment. And in stage four, the client learns to experience a deeper sense of freedom, joy in living, or spiritual meaning and fulfillment. In general, DBT usually includes weekly 2.5-hour group sessions on skills training and weekly therapy sessions. It's generally meant to be short term, however, usually ends up being long term, as from what I've read, several clients tend to like it and tend to stick with it. So looking at the critiques of therapy, there is so much that is said about DBT. Most of it is good, actually. All the research that I found, the majority of it, all is positive. But most of it relates to borderline personality disorder. There is some regarding addiction, some regarding adolescence, but still it shows that it works. It definitely works. However, I did see that there are some areas that require some further research. For instance, most of the research that's been conducted has been conducted on females. There was only a couple that were done on males, and those were in like a forensic setting. And I wasn't able to find anything on any multicultural studies. So that's another area that probably should be looked at. Additionally, there was studies on the skills group training alone without the individual therapy, and those were mixed. Like on one hand, they said that everything was good with it, and on the other hand, it had mixed reviews. So that probably needs further research. Looking at DBT and seeing how it would align with a biblical perspective, it does align in a couple areas. The first area is acceptance and forgiveness. DBT emphasizes acceptance of oneself and one's current situation, coupled with a commitment to change. This aligns with the biblical idea of accepting oneself as a flawed but loved individual, capable of growth and redemption through forgiveness. The other areas in mindfulness and prayer. DBT incorporates mindfulness practices to help the individual become more aware of their thoughts, emotions, and behaviors without judgment, which of course aligns with a biblical perspective. So here I have a case example. The one I wrote is about an individual who suffers from some depressive episodes, and he goes to see the therapist because he wants to learn how to get out of this cycle that he gets in of hopelessness and helplessness. And he talks to the therapist about how, it just comes about. He can't even get out of bed. He can't eat. He can't do anything during this time. The therapist asks a lot of questions in regards to that. And then ask him exactly like what he's tried in the past and has that worked for him. Then she works with him on some basic distress tolerance. She explains to him what distress tolerance is and teaching him to let's use your 5 senses. She asks the individual to think of a scene that they can fixate on for at least 1 minute, maybe something visual, something that he can smell, something that he could hear. And so the client goes through and thinks of all these things using all of his senses. And then he tells the therapist that he does have a fear, despite the tools that she's teaching him, that it's not going to work. Like, he may know these tools and it may not work. And the DBT therapist lets him know that it's about accepting that, it's going to happen, that he may end up having these spells. But she's teaching him tools and that's going to change it, and not to be afraid because it's coming, but to know that he has skills to deal with it and he has done it before. And yes, it's hard, but he has done it before and he's okay. Basically, it's just a vignette or of the skill learning the distress tolerance skills in a session. Some key resources I put down here are some books. Quite a few of the books you'll see are from Marsha Linehan herself. There's a great book in there on skills training for adolescents as well. I do have some articles listed that I found interesting if you want to check those out. And then, of course, there are a few videos here. I did find some really great videos of an enactment of a therapy session by Marsha Linehan herself. This was at a university. It is a 3-part video. Each video is a little over 20 minutes long. Unfortunately, it has taken me quite a few days just to learn how to record this PowerPoint. So I will have to attach the links because I think because of my Mac, I actually have to play these in the recording. So I will attach the links to each one of these videos underneath the PowerPoint for you to look at, but they're pretty cool if you want to see the master at work. Thank you for taking the time to watch my presentation. I look forward to watching yours, and I hope you learned a little bit about DBT.